Good morning. I'm Al McFarlane. You're listening to Conversations with Al McFarlane. Today's broadcast is from the Bigelow Building in St. Paul, Minnesota. We are the guest of the Community Action Partnership of Ramsey and Washington County. And today's program is a special one indeed. We're talking about an issue of vital importance to our community and to our country. The topic today is health disparities, and to engage our community and the world in this important conversation, we've invited two stellar leaders in the world of health and policy to join us today. Joining us from California, Dr. Richard Allen Williams. Dr. Williams is a surgeon, a prolific cardiologist known for medical leadership. He recently published Eliminating Healthcare Disparities in America. In 1974, he founded the Association of Black Cardiologists and served as its president for a decade. Dr. Williams also established the Minority Health Institute, and in doing so created a new paradigm for eliminating health disparities, a paradigm that takes a holistic approach to patient care, tailored to the specific unmet needs of African American communities. In 2001, he was cited among Black Enterprise Magazine's top 100 doctors. And joining the program from Washington, D.C., the Honorable Donna M. Christensen. Donna Christensen is the first female physician in the history of the U.S. Congress, the first woman to represent an offshore territory, and the first woman delegate to the United States from the U.S. Virgin Islands. Delegate Christensen is a member of the Congressional Black Caucus, and she chairs the Congressional Black Caucus's Health Brain Trust, which oversees and advocates minority health issues nationally and internationally. The Congressional Black Caucus Health Brain Trust has long established itself as an authority on African American and minority health policy on Capitol Hill. And as the CBC Health Brain Trust, under its able leadership of its chair, embarks on health legislative efforts, it does so knowing that racial and ethnic health disparities and the absence of racial and of health equity and justice have long plagued health care, and life opportunities of African Americans and other people for the last century. Well, locally, this program is pleased to have stellar leaders talking about and reacting to the presentations that you'll hear momentarily from Dr. Williams and Dr. Christensen. Locally, my host organization is headed by Clarence Hightower. Clarence, good morning, and thank you for being here.
Good morning, Al, and we're pleased to host you this morning.
Your counterpart is Mr. Bill Davis. Bill Davis heads the Community Action Program of Minneapolis. Thank you, Bill, for being here.
Well, thank you, Al.
And Mitchell Davis is representing the Office of Minority Health in Minnesota. Mitchell, thank you for being here.
It's good to be here today, Al.
Let me begin by going to Dr. Richard Allen Williams. Dr. Williams, I'd like for you to state the case. Let's talk about what is the problem with eliminating health disparities in our country. I think we've, over the past 10 years, talked a lot describing the gap in outcome for people of color and Black people in particular, but we haven't focused extensively on eliminating health disparities. You've done that in creating a book. The book is called Eliminating Healthcare Disparities in America. What are the challenges, and how do we get to where we have eliminated the gap in experience in health for minority people?
Well, first of all, Al, let me congratulate you for making it possible for us to focus on these problems of healthcare disparities today. I think this is something that we need to see more of around the country, and I'm sure Congresswoman Christensen would agree to that. We need more information going out there. Now, today we're talking about healthcare disparities, and the first thing that we need to do is to define the term and also give an indication of the nature and severity of that problem. Healthcare disparities really is a term of convenience which is used to describe the differences that occur between racial and ethnic groups in regards to what we call morbidity, mortality, incidence and prevalence of disease, and certainly outcomes of disease processes. There are tremendous differences that go along ethnic and racial lines. Now, one of the things that we need to identify is where these healthcare disparities come from. They emanate really from something that is deep in the roots of our country, of our history, and that is slavery. It all started back at the time when African Americans were in bondage, and I won't go into great detail about that, but I want to simply indicate that it all started with the maltreatment and poor treatment of slaves who were in bondage and who were not able to do for themselves as far as healthcare treatment is concerned. And it has come forward to today where we see problems occurring in every area of our lives, not just in terms of healthcare, but in terms of a number of things that impact upon our very survival. I want to end this introduction to healthcare disparities by making sure that everybody realizes how serious a problem this is and connect the history to the current situation. There was a person who was called a demographer back in the 18th century named Hoffman, who took a look at the slave population of the United States and looked at their health care and their living conditions, their chances of survival. And he made a prediction which rattles our consciences to this day. And that is that he predicted that the slave population would not survive beyond the year 2000 because of the healthcare problems which were extant at that time. Now, obviously, African Americans have survived with great difficulty, but I think what we need to take from that message, is the fact that these problems were and still are so important that we need to give a great deal of attention to trying to solve them. And during the balance of our discussion today, I'm sure that we'll get into some aspects of that. So I'll stop at this point and see if there are other inputs, certainly from Congresswoman Christensen, who, by the way, I think you alluded to the fact that she is an MD as well,
Yes.
a medical doctor. And certainly, I'm sure that all of us would like to hear her wisdom on this topic.
Well, Dr. Christensen, let's go to you, and thank you for taking time to join this important conversation. You've been on this show before, so it's good to see you again, and thank you for taking the time. But, you know, this is a new day, a new era, and public policy is more important than now than ever. I would like you to take a public policy viewpoint, talk about what the challenges are, how do we move towards eliminating health disparities, what the legislative strategies are to move our country forward.
Well, thank you, and thank you for having me back again, and it's great to be here with my good friend, Dr. Williams. We've been on several programs together, and he's been a guest at our Health Brain Trust as well. Well, I think Dr. Williams has kind of laid out the history, but I just want to point out that even today, the last national report on health disparities from the department shows continuing gaps in health care and healthcare services, and the fact that we are still more minorities, African Americans and other people of color are more than 50% of the uninsured, and we still face discrimination in healthcare even when we are insured. And there was a report given to the American Public Health Association just last month showing bias towards white patients and against Black and other ethnic minority patients, just in a review of articles and reports. So we face a lot of challenges. The Congressional Black Caucus bases its healthcare agenda on 4 basic principles.